Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Hello, everyone, and welcome to a special edition of This Just In Radio. I'm your host, Justin Barnes. Today, we're broadcasting live from Tampa, Florida, in the Moffitt Cancer Center. We are graciously invited to join the CancerX Leadership Summit and have several other leaders joining the show to launch our new Cancer Innovation Series. Many thanks to Dr. Kamal Jethwani and Dr. Nainesh Parikh for their hospitality in making this on-location series happen. This specific Cancer Innovation Series was initially derived from a conversation last October at the health conference in Las Vegas, where I became very optimistic about the strides in cancer care, innovation, and patient outcomes. As we're outlining these episodes, it became even more obvious why we need to tell these encouraging stories about innovation, survivorship, and curing cancer. I hope all of you find these episodes as enlightening and encouraging as me, and I expect to host a follow-on series later this spring, so stay tuned. And now to launch this Cancer Innovation Series with me, please welcome back two familiar voices to the show. Vice President of Digital Ventures for Moffitt Cancer Center and the Chief Executive Officer of AccelerOnc Studio, Dr. Kamal Jethwani, and Vice President and Chief Clinical Expansion and Partnerships Officer for Moffitt Cancer Center, Dr. Nainesh Parikh. First, Dr. Jethwani. From your perspective, what recent advances in cancer innovation are you most encouraged by, and why do you believe they're meaningful?
Cancer, there's a lot of money being spent on cancer innovation, right? And so if you think about diagnostics, therapeutics, think about the genetic testing that's coming up, there's a lot that's allowing us now to treat cancer as close to N of 1 as possible, right? We're getting so much data, so much information about the cancer itself and about how that cancer affects the human being that we're able to sort of treat every patient almost uniquely, right? And that's really powerful because now we're making sure that patients are being taken care of at that level. But what excites me really the most is that we now, through the emergence of AI and digital, have an opportunity to actually make treatments that are available for patients reach them, right? Mm-hmm. Despite the advances that we've seen in precision medicine and despite the advances we've seen in the number of molecules we were coming out with, a lot of patients that are being treated in this country, especially in the community centers, don't actually have access to the best possible that's available to them, right? But we can change that with digital and AI, and I'm really excited about making sure that every single patient gets access to every single innovation that there is that can benefit them and that can basically cure them.
And so when we say we, obviously speaking from CancerX, but also what you're doing here at Moffitt Cancer Center.
At Moffitt, exactly, yeah. Moffitt has one of the largest teams that is working on this problem. We have one of the largest data sets in cancer centers. We have spent the last 20 years collating this data, and we've spent a lot of time creating a team that's going to be thinking about how to quantify it and how to think about quantitative sciences. We're the only cancer center in the country that has an actual department of machine learning and AI and mathematical oncology. And so we're really thinking about this from all these different directions and bringing the best of what AI and math has to offer to the front lines of the clinic, right? So we're actually treating patients this way already. That is not happening anywhere else.
Yeah. I love it. That's why I'm very excited to have the radio show be here for the next couple of days. So what are you currently working on that you're most excited about? And then how do you connect that to patient care and outcomes?
Yeah. Let me start with the problem we're solving, right? Medical knowledge today doubles every 73 days. Right. So just think about that. That's a huge amount of volume we're creating. The impact that has on cancer is that our cancer guidelines are updating very, very frequently, as many as 241 times last year by NCCN. If you take a specific example in breast, that's about 54 times a year. That's once a week. So just imagine as yourself, as a general oncologist, practicing in the community where you have 18 different types of cancers that you're potentially seeing, and everyone has guidelines updating somewhere between once a week to once a month. How do you keep up? How do you keep up? You don't keep up. Yeah. And what's the impact of you not keeping up? The impact is that these patients basically get treatment that is 6 to 9 guidelines behind, right? Wow. That is, and about 50% patients today, we know this for a fact, do not get guideline concordant treatment when they go and get treatment in the US, right? That is a significantly worse clinical outcome for them. Literally, the difference could be between life and death, depending on where you go to be seen.
Wow.
Right? That is a problem. Now, if you think about the solution to this problem, we can't just do more with what we have today. We can't just expect oncologists to keep up. We can't just expect them to do more CMEs. We can't just expect them to go and read more papers. Humanly impossible, right? So we are building a tool called OncoBrain, which is the world's first AI oncologist that brings guideline concordant care to the point of care, to that relationship between the patient and the provider, right? So every single provider is able to provide guideline concordant care to every single patient that they see without exception. What we think that that's going to do is that's going to revolutionize and match where we are in time and history for oncology, right? Today, if we can make sure that every single patient can get guideline concordant care, we can potentially end cancer as a death sentence. And that's what we're working on.
I love that. That's the whole reason we're here, is ending cancer as a death sentence. So I guess for the average patient who's listening to this show right now, how do they start this journey? I mean, obviously, they may have a doctor, they may not have a doctor, but how do they go and ask their doctor about guidelines or what guidelines? You don't want to challenge them because everybody's in a different sphere and has access to different stuff. But to your point, the odds are they're probably behind in some capacity. Yeah. What's a good advice for a patient?
So, as of today, without any of the huge, crazy innovations that are available, right? Like I'll just talk about current state, right? If one of my family members got cancer, what do I do?
Yes.
Right? Okay. Here's your playbook.
Yeah, love this.
Okay. Yeah. So first of all, you will try to get into depending on how you sort of discovered your cancer, it's either in the emergency room or your primary care doctor picked it up or whatever it is. You will always try to get to the best specialist you can within your reach.
Right.
It doesn't matter where you are in the country. There's probably someone around you that's an NCI designated cancer center. You go there, right? That's statistically significantly better clinical outcomes.
Excellent.
End of story. Once you get your diagnosis and your initial treatment, you always get a second opinion.
Okay.
Oncology is one of the only fields where this will actually create a 40 to 50% difference in your treatment outcomes, right? So you always get a second opinion. There are a lot of virtual second opinion services available through your employer now, through your payer. Figure it out. Most of the times it's free for patients, right? But they don't take advantage of it. So, and that's criminal. So get to the nearest NCI designated cancer center, then get a second opinion, follow the second opinion through, right? And then always think about what options do you have, both from a treatment perspective and a clinical trials perspective. There's always clinical trials going on that are really testing the next sort of frontier of treatments, and our treatments are just getting significantly better. And then the last thing I'll say is, because of the amount of precision available today, make sure that you have access to every single one of the most advanced testing available, radiology, genetics, et cetera, because that'll just give your oncologist a little bit more to play with in terms of how to decide your treatment. If you do those, I think, to me, pretty basic steps, you're on the right track, right? And then comes the question of treatment decision making and how much you're able to tolerate in terms of procedures versus toxicities, et cetera. Those are things that are so difficult to deal with in the moment. I would say your last thing that you would do for yourself and would be a game changer would be to get a patient advocate. They're about $300 a month. They are fully reimbursable. You have a little bit of a copay, but the way they work with you and the way they help you think through your process and your decision making is magical. And even as a physician, don't think that way. So I would say every cancer patient should get themselves a patient advocate.
That's fantastic advice. And actually driving up here, thankfully I live within 30 miles of Moffitt and coming up here, I thought how fortunate I am to have access to you guys and the relationships that I have. If I ever had cancer, how blessed. So I'm glad you just gave that information. That's a fantastic best practice.
And if you're a first degree connection to us, call us.
Absolutely. Or text. Yes, absolutely. We'll do. So now shifting gears a little bit, specifically around CancerX, what are your goals for CancerX, and what do you hope to accomplish here in 2026 alone?
Yeah. So CancerX was created with the vision that we wanted to make sure that we are equalizing access through digital innovation, right? And the problem I spoke about first, which is, how do we make sure that every incredible innovation is available to every single patient? It was part of a moonshot thinking, and when we started, we always said it was going to be really difficult. And we set ourselves a goal that we wanted to reduce cancer mortality by 50% by 2047. Yeah. It's a big goal.
Absolutely.
And we think that we're going to get to that goal by making sure that patients get access to the right treatments at every single point without exception, right? The way we get there is through the use of digital and AI. And now, if you think about that entire roadmap, the place where everything is broken is it's really, really hard to get new innovations into old systems that are working the way they were working in the 1970s, and they have no incentive to change, right? So the goal for CancerX is to make sure that we become the national infrastructure to scale digital oncology. That's what we are, right? And so what we are going to do is we're going to build the building blocks of this infrastructure. We're already doing a lot of that. You'll see that in the next 2 days.
Yep.
And what we're also doing is we're making sure that now we're matching unmet needs with really good ideas that are available in the market. With startup companies, scaled companies, whatever, we test them out, we prove that they work, and once they prove, we want to become the infrastructure that helps scale them to the next 100, 200 organizations. If I keep doing this every single year, and we do this for the next 20 years, we're going to have a couple thousand technologies scaled
Amen.
across cancer, and that's the impact that CancerX is going to create in the world.
I love that. How many people are involved in CancerX today from organizations?
Yeah, so about 150 to 180 organizations are involved right
Globally?
now. Globally. Yep. A good amount, about 80% of that is in the US.
Yep.
Right? And we're fortunate to have representation across payers, providers, pharma companies, startups, venture capital, private equity, banks, right? So we have a lot of the ecosystem really sort of represented. And the magic happens in the intersection of these, right? Which is where we see a lot of stuff happening. So payers working with providers and startups, or pharma working with a provider and a VC. Those kinds of relationships are where a lot of the magic is happening, and we think that that's the power why we think we can help with this infrastructure problem.
I love it. And this conversation initially came together. You, me, and Dr. Parikh were sitting actually HLTH in 2025, just last fall. And I believe, and we'll talk about this in a follow-on segment about, we have the ability to cure cancer. So even with the things that you're talking about, or create it more as a chronic condition. We're going to talk, more about that coming up. But I'm very excited about, what you just said is phenomenal, and then also the opportunity in the land, the advancements we're making. So here in the last question, looking into the proverbial crystal ball, what strategy, capability, or shift must CancerX be ready to navigate in the next 2 to 3 years from now to meaningfully accelerate progress?
We're sitting in a very fast-changing world today, and there's a few tech forces that are shaping what the next few years of the world are going to look like, and robotics, AI, artificial intelligence, all these other forces are coming to play. What I would say is that healthcare has typically been shielded from any of these tech bubbles because we just don't care, and we've looked the same we've looked in the last 50 years. Right. But I think this time is different, right? And I've been in healthcare now for 25 years, and I feel the difference this time, right? This time we're not going to be untouched. So what do we, as CancerX, need to do to make sure that we're shifting oncology in the right direction in this move so that we really benefit from it and we don't struggle under the weight of what this is going to do to us, right? Excellent. And so what does that mean? That means that, how are we helping organizations transform? How are we helping organizations keep up? How are we helping organizations govern? How are we helping organizations adopt it no matter what? Because at this, in the 12 minutes that we're having this conversation, 12 more people died of cancer. So we can't stop, right? We need to make sure that adoption is happening, but for all the fears that we have and all the things that it's going to disrupt, let's figure out a way to help people through that so that we still can innovate and we can still get the right treatments in the hands of patients.
I love it. Dr. Jethwani, thank you so much. Will I see you at HL or Vive coming up, or HIMSS?
I will be there. Vive
in LA. Awesome. Fantastic. Thank you, my friend, and thank you for hosting this, allowing us to come here with the show. We'll be here for the next couple of days. We've got a lot of great sessions. But what you're doing is applauded, globally, but obviously throughout our community. And this was a blessed opportunity to go up and do this. So thank you so much again.
I'm so thrilled that we got you here, and so thrilled that we can co-brand this.
You got it. And we're just starting this series. We're gonna have some good fun with it over this year.
Awesome.
So, thank you.
Thank you, sir.
Appreciate it. And now, Dr. Parikh. Dr. Parikh, from your perspective, what advancements in cancer innovation are you most encouraged by, and why is it meaningful?
I think I'd break that down into a couple of different buckets. So, in the first place, as we all know, screening and prevention, really detecting cancer early, is the easiest way to cure it. So the ability for digital tools, since we're talking about digital technology.
And curing cancer.
Goes hand in hand with preventing cancer.
Yep.
Screening tools, improving our ability to screen for even things like colorectal cancer. And what I'll say is, through CancerX, I know we'll get there, but seeing the amount of passion and the amount of brain power being dedicated and committed towards screening and prevention is key. So I won't say one technology in particular, but I will say the bucket of people that are committed to improving screening and prevention is incredibly exciting. The second thing I'll say is, this isn't necessarily an advancement, it's just kind of like a curious occurrence. You're seeing this around the world, particularly in our country. People are more engaged about screening and prevention. So, for example, you're seeing a lot of these whole body CT scans, MRIs, things like that. What's curious about it is that no single medical organization has said we definitely approve it. But no one's come out and said we don't approve it. And by the way, those companies are doing well, right? They're scanning, they're opening more shops, people are getting them done. What's exciting to me, we're at this inflection point where people are really interested in knowing. And if we focus on cancer, I think the ability to marry the technology that's coming out, the ability to give recommendations to the population that's interested in hearing it, whether it's around nutrition, it's around occupational exposure, it's around environmental exposure, that kind of 100,000-foot view to me is what's most exciting. The last thing I'll say, I think the ability for therapies to be more targeted when you do have an awful diagnosis like metastatic cancers.
Which you're an expert in.
Unfortunately, yes, both personally and professionally.
Yeah.
I think the ability for targeted therapies, so for example, cellular therapy, which Moffitt has been leading the charge in for at least the last decade, has been something that really blew the lid off of how we use immunotherapy to improve outcomes in liquid tumors. Radiopharmaceuticals is exploring that as a type of targeted therapy in solid tumors. I think we're just scratching the surface, and the ability for us to use those advancements with a backbone of digital support, whether that's AI-enabled prediction, AI-enabled clinical trial matching. I mean, it goes on and on. I think those buckets for me are the areas that are the most exciting.
That's very cool. What do you really see? I guess Dr. Jethwani talked about the passion, certainly with the cohorts and the leadership and the team and the partners at CancerX. But what are you most passionate about when it comes to, obviously, what you work on a daily basis, but also when you see the opportunity to cure cancer or innovations in cancer or even advancements in patient outcomes?
That's a loaded question.
Yeah.
So, little bit related to what we were just talking about, but honestly, what I'm most excited about is the ability to make the journey easier for the patient and their family.
That's awesome.
So when I say easier, again, I think back to my own personal experience. When my mom had cancer, I didn't feel like a physician. I didn't feel like an oncologist. I just felt like a son who was trying to figure out a way for my mom not to suffer, truthfully.
Right.
Never mind live longer, right? And those are two really distinct pieces.
Yep.
As patients and loved ones go through this, we can talk about therapies all we want, and we can talk about data, and we can talk about overall survival, progression-free survival. All these things are great. But what's lost oftentimes is the fact that that patient is still suffering. So what I think is the most impactful, certainly what drives me, maybe I'm taking your question a little bit differently.
No, it's great.
Really what motivates me is the ability to impact that experience, because what's the most heart-wrenching is for a loved one to be suffering, right?
Right, absolutely.
Whether it's a child, it's a parent, it's a brother, it's a sister, it's even an uncle, a nephew, a niece, whatever it is. To see someone you love suffer, especially as a result of the things that they're being given. And then oftentimes, I got to tell you personally, I think to myself, gosh, if I were in that position and I knew that none of this was curative and I was just fighting for an extra day, an extra year, an extra 5 years, how would that feel? Right? And then you go out, we're in Florida right now. It's been cold snap down here. It's been maybe 35, 40 degrees. Right. My house isn't built, it's a few leaky windows, right? So it's cold. It's cold at night. Yeah. But then I think to myself, gosh, my mom, when she was receiving chemo, was in the dead of winter. She was already feeling crummy because of the chemo. Yeah. And it was for a diagnosis that really was not going to respond well. How would I feel? So to me, what's really making me most impassioned, again, at the 100,000-foot view, is to say, listen, you've got all these bright people who just want to make one impact, right? If you can improve the patient experience, if you can minimize suffering, never mind improve outcomes, right? I mean, I feel like we're on the precipice of figuring that out.
Right. I love that. No, that hits home for sure. And actually, everything you said hit home, even because I lost my heat a week ago. Right as the cold snap was coming in, my HVAC unit went out, and it's. They can't get out there for a couple more days, so I've been traveling a little bit. Right. I've been home because I have no HVAC.
And it's not meant, it's not meant to say, oh my gosh, it could be much worse. It's just meant to say, listen, when you boil it down to what's important, and that's why all of us feel the same about cancer, right? When you boil it down to the suffering, when you boil it down to, struggling to live, and then questioning that existential question, is it worth it? Which is just an awful question. Yeah, that's what drives us every day, right?
Well, and also that's why we're here. I mean, that's what drove this series. I was so excited when we all met at Health Conference last fall and literally talking about, access to curing cancer, innovations in curing cancer, creating cancer as a chronic condition where we can actually treat it and basically save lives, increase quality of life, improve quality of life, reduce suffering, all of that. It became, a side passion of mine. We put a whole great series together, and I'm grateful. And it really started with the dialogue with you, you and Kamal. So,
well, thank you for having us.
Yeah.
This is, any opportunity to lean in. As you can tell, I'm pretty passionate about
Absolutely.
it. So, any opportunity.
well, this is gonna be a good year for us in all these regards. So, what are your goals for CancerX, and what do you expect to accomplish in 2026?
Sure. So, as you know, I'm the steering committee chair for the CancerX Accelerator, which is the committed program around accelerating small companies or early stage companies, however you want to define it, to be successful in the digital oncology space, right? Goal for CancerX overall is to mature not only the accelerator program, but all the other programming that allows us to serve as that digital infrastructure for oncology across the nation, right? Furthermore, the ability to see real impact either through cohort companies or through programming, and see both small companies and major health systems alike contribute to the reduction of cancer. If we can actually see some meaningful moving of the needle, and even in certain areas in 2026, and I know that's not a very specific actionable item, but really all of our efforts coming together. So defining structured data elements, defining how we can actually cobble together sharing of certain amounts of data across systems, right? Creating those ecosystems and collaborations. Never mind seeing one or two accelerator companies come up with commercially viable products. And I'll say this pretty clearly, for me personally, success isn't necessarily about an accelerator company getting acquired. That's great, right? And that's great for shareholders, and I believe in the free markets.
Sure.
But what matters to me is seeing these products live on and getting patients using the products for their benefit, right? That's why we're doing it. So for me, in 2026, I think at the CancerX at large, starting to lay the groundwork for how we innovate at scale, how we move the needle, and how we really define what we are as the digital infrastructure for oncology care.
Right.
That's number one. Number two is seeing any of our CancerX Accelerator cohorts, even from 2 years ago, create products that are really getting to the hands of millions of people across the nation.
Right.
For me, that would be a win.
Yeah, and that's absolutely moving the needle. How many companies are in the cohort today, or how many will be there in this year?
12. So 12 made it in this year. We had 39 finalists, right? And I just want to talk, since you're asking,
Absolutely.
a little bit
Please.
about the process.
Please.
We've had engagement from so many champions, right? Moffitt's always been there. I'm fortunate to be at Moffitt. Advocate's always been right at our side. But we've had Atlantic Health. We've had Rush that are new entrants into the ecosystem. We've still had participation from Memorial Sloan Kettering and from Dana-Farber. Really, just the list goes on, and it's been incredible to have these folks show up, right? So in the first place, the number of champions that have been participating has continued to go up. The number of total people, I think it was around 60 or 70 people from all of those institutions giving hours and hours of time to evaluate these companies. And we had 39 finalists, from which 12 were selected, and very excited about the 12.
I love it. And you do this annually? So in 2027, there'll be another... Will it always be 12, or...?
No. So good question. So typically, the applications come in the fall, and we've been tweaking the process each year as we learn quite a bit. This year, the process started in September. We had over 100 applicants, which is fantastic.
Yes.
So there's a couple of repeats in there, which is great because I think it improves your chance. I think each year, these companies are maturing quickly. So over 100 applicants in September. The evaluation assessment period really happened October, November, and then early December. And then, it's the holidays. So we wait a little bit, and then we announced at JP Morgan the final cohort. What we do is we define themes. We started originally with 3 themes. This year we had 4 themes. I won't bore you with exactly what they are. Suffice it to say, we try to get representation across all 4 themes because we think those themes will drive innovation in oncology. So we always want to have cohort companies represent each theme, and they self-identify as far as the primary themes, for their products and services. Where I'm going with this is we don't necessarily have a cap or a minimum.
Okay.
We want to try to say, listen, if we have companies that are interesting, that fit the criteria, great. What's more important is that not only do those themes get represented, but that the champion organizations that want to work with those companies raise their hand and say, yeah. And this year, what we really go for is having 2 champion companies raise their hand and say, we want to work with those companies. So you can imagine that if we had 20, we would do it. What's really important and vital is the engagement on behalf of each of the champion organizations to raise their hand and say, yeah, we're going to be side by side for this compressed period of 6-7 months. We're going to be there. We're going to be, showing up and giving feedback. We're going to be putting our leaders in front of those organizations and in front of those companies so that those companies have a meaningful experience.
I love it. Well, I'll also tell you, you want to do I'll do a show later on this year. Were you looking for more cohorts or for 2027?
Perfect.
Love to do a show on that.
Yeah.
Let's talk about the programs, the themes, all that kind of stuff. But then also, if there are any shows any companies that you want to highlight that are in the cohorts, hey, these guys are whatever, the winner or whatever it is,
Yeah.
we'll bring them on here. And all that
Okay,
good
no,
stuff.
that'd be fantastic. I appreciate that.
You got it. 9. I appreciate it. We're actually at time, so we're good. But are you going to Vive
Yes,
this year?
I'll be there. I'll
You
be there.
in
We
LA?
have a lot of good CancerX programming.
Yeah.
Very excited. It's going to be fantastic. So you'll be there.
Absolutely.
Are we
I'm
recording
ready.
again?
Oh, yeah.
Oh.
Absolutely, dude.
All right. Maybe this time Kamal and I will actually have the opportunity to interview you.
Oh, no. That'll be fun. We'd love
Exactly.
it. All right, 9, thank you so much, my friend.
Awesome.
Appreciate you.
Thanks.
Well, that's a wrap from Tampa and the Moffitt Cancer Center and CancerX. Thank you all for listening, and I certainly want to offer a note of gratitude to the leaders of CancerX, Moffitt Cancer Center, Advocate Health, Fred Hutch, Amazon Web Services, Rush, and other leading cancer centers, life science organizations, and technology. Together, these voices provide a comprehensive view of how collaboration between providers, researchers, and industry is shaping the next decade of oncology innovation. And a special note of thanks to Jake Reed, my head of media. Jake did a phenomenal job managing this remote podcast and also keeping all of us on track. And as always, a big thank you to all my listeners. We're grateful for you, and you make us better with every broadcast. And please stay tuned in weekdays as we broadcast at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can find me at LinkedIn at Justin T. Barnes or track me on Twitter at HIT Advisor and use the hashtag #ThisJustinRadio so you can respond to your comments from the show. If you miss any part of this broadcast, all of my This Justin Radio shows are posted on Amazon Music, YouTube, Spotify, Pandora, Apple Podcasts, iHeartRadio, SoundCloud, Spreaker, and the TuneIn platforms. And also check out the content we published in the new Thought Leadership page at justinbarnes.com. Thanks, everyone. Have a great rest of your day.